Human trafficking. In the state of Ohio, it is a tragic reality. Every day, men, women, and children are trafficked. They are the victims. And healthcare providers are uniquely positioned to come in contact with and identify those victims. However, a 2012 study of emergency department professionals found that less than 3% of those surveyed had received any formal training on human trafficking, that less than 20% were confident they could even define human trafficking. Just 5% were confident in their ability to identify a victim of human trafficking, and only 7% were confident in their ability to treat a victim of human trafficking. On March 29, 2012, Governor John Kasich signed an executive order creating the Ohio Human Trafficking Task Force, which recognizes that the training of healthcare professionals in identifying and treating the victims of human trafficking must be a priority. What is human trafficking? The simple definition: it is modern-day slavery and is the compelled service of others for profit. Human trafficking exists in two forms: sex trafficking and labor trafficking. Both forms have been found in Ohio. According to the federal definition, sex trafficking occurs when a commercial sex act is induced by force, fraud, or coercion, or in which the person induced to perform such an act is not yet 18 years of age. How can a person become a victim of trafficking? It can start like this.
So this guy came up to me and he was very good looking and he had a wonderful smile and it was very nice, and he said he was going to go and he was going to get me dope. And so I gave him money and I knew he wasn't going to bring me the dope back, but he did. And he boyfriended me. And I hate telling you that. I hate that that's the truth. Just was very loving to me and giving me things that I didn't even know that I needed or was seeking. He would just tell me I'm beautiful and tell me I'm funny and like I look better than anybody out here. And then one day he went from the light to the dark. He went from being loving and caring to, you're going to do what I tell you to do. And I knew that he was right. I knew that if I didn't, that I would be hurt. And that's how I started to be trafficked.
Vanessa is a survivor of sex trafficking. She was beaten, coerced, traumatized. In a clinical setting, she would have exhibited many of the signs that medical professionals should look for. What are the indicators of sex trafficking that medical professionals need to be aware of? The first thing you'll notice when victims show up at your emergency room, clinic, or office is they are often accompanied by their trafficker or an associate. As you begin to ask questions, the trafficker may attempt to coach the victim's answers or not let him or her answer at all. Their goal is to control the situation while revealing as little information about the victim as possible.
They will not let the trafficked victim be alone, answer questions on their own. They will answer for the person. They will be short and forceful in what they want, because in the end they want this medical attention, this medical problem to be addressed. They want it treated and they want to leave.
As you continue to talk with the patient, you may have confirmed from the conversation or from medical records that he or she is under 18 and either admits to or shows signs of involvement in the sex industry. Those signs can include a history of multiple or frequent sexually transmitted infections, STIs, and evidence that they have not been treated. Or the patient may reveal that she has had multiple pregnancies and abortions to terminate them. For female victims, there may be evidence, such as cotton balls or other products that leave residual fibers, that the victim has been coerced into having sexual intercourse while on her monthly cycle. In listening to the patient, you may hear him or her using lingo or slang related to involvement in sex trafficking and prostitution, referring to it as the life. And if you see tattoos on the patient's neck or lower back, and she doesn't want to explain what they mean or why she got them, that's another indicator of her being a potential sex trafficking victim.
Unusual tattoos, or tattoos with a guy's name on them, or tattoos with a crown. Tattoos in unusual places as well. One woman had a tattoo in a private area that said property of a man's name. So that's obviously very obvious, but you'll see gang insignias on their necks. white boys was a tattoo on one woman's neck that she didn't want to have on there. So some of these tattoos are very significant, and if you start to study what those are, you can pretty much quickly pick up on the fact that she may have someone who's influencing her to do things in her life that she doesn't want to do.
In addition to tattoos, the patient may display other types of branding, such as cutting or burning. She may also have bruises, black eyes, and appear malnourished. You may be able to discover if she comes from an abusive situation at home or has a history of substance abuse. All of these are indicators of sex trafficking. When you offer to help, the patient may resist it or demonstrate fear. This is because she is afraid the information she gives you might lead to her arrest, placement in social services, being returned to her family, or retribution from her trafficker.
It may be that they know that they are being watched and guarded. Their answers are not forthcoming, and they may also be very reluctant to provide accurate information. Their story may not add up. It may change.
What to do if you suspect that a patient is a victim of sex trafficking? It is important to note that safety concerns for the patient, your colleagues, and the public should be addressed in your facility prior to the first time you identify a potential victim. If you do not know your facility's protocols for alerting security in cases such as this, be sure to get that information from your facility administrators. The crime of human trafficking is a first-degree felony. Reporting it is mandatory. All mandated reporters must report suspicion of sex and labor trafficking to law enforcement. The first thing a medical professional should consider is whether they can have a private conversation with the potential victim without jeopardizing their safety. This means trying to separate them from their trafficker. To do that, you might say that the patient needs an X-ray, scan, or other test, and in order to have that done, can only be accompanied from this point on by a doctor or nurse. Or, in the case of patients 18 years old or under, citing hospital protocols can be an effective option.
And so stating it in a form or fashion that, with all of our teenagers who come through the clinic or through the emergency room, we do like to speak with them alone, to ask them some private questions about their health and well-being. So we would ask you to please step outside. And framing it in a form of, we do this with all teenagers, it's our protocol, may be helpful, but we definitely want to speak with that individual alone and try to then get the history from them. And you may not get much more of a history, but taking that opportunity is crucial in finding out the truest information you can.
The private interview will drive the questions. You can ask if the patient has been forced to have sex, or has had to exchange sex for drugs, food, shelter, or to pay off a debt. Has the patient been threatened with physical abuse or harm if she refuses her trafficker's demands? Does the patient know the difference between consensual and non-consensual sex? If you can't separate him or her from their trafficker, you'll need to ask questions that are more generic, such as, where do you sleep and eat? Do you have identification or a passport? Can you leave your job or stop working if you want to? What should you listen for in the victim's responses? They may sound canned or rehearsed, signaling that you may have to dig deeper to get more information. Try to ask open-ended questions like, what would happen to you if you leave your job? Victims may not make eye contact with you or be evasive in answering. Knowing these indicators and signs is crucial because the victim's fear and trauma may prevent them from opening up. In either interview situation, whether in private or not, you are trying to show the victim you can be trusted. You are here to help. Their safety is your first priority, and we will give you the medical attention you need. Conducting an assessment exam with a potential victim. When you conduct an assessment exam with a patient you think may be a potential victim of sex trafficking, you can proceed in several ways. First, be sure to utilize existing assessment and examination protocols for victims of sexual abuse. Use existing culturally sensitive protocols as well. When you ask about sexual history, be sure to distinguish between consensual and non-consensual experiences the patient has had. If you're working with minors, use age-appropriate language. Try to conduct the interview in a comfortable space which offers confidentiality. If it is appropriate, separate the patient from their belongings and other individuals. You may notice that the patient is wearing or carrying a GPS transmitter, cell phone, or other electronic tracking communication device. By getting the patient into a gown and an X-ray room, you can separate them from these devices. If the patient is a female, approach should be made by a female staff member, whether a psychologist, physician, or social worker.
We have to be careful when we identify someone that we think ahead of time. What will we do in our situation, in our own clinic, in our own emergency departments, wherever we practice? That we have a plan in place so that when we identify someone, we can make the right phone call to the right people who can respond as quickly as possible and keep this person safe.
If in the course of the interview or examination you feel that the victim is an immediate threat of harm, do not wait. Call 911 or your on-site security department for help. If you have additional questions about how to report a suspected trafficking situation for adults or minors, please contact the State Medical Board of Ohio at 614-466-3934. For additional resources and information, please visit humantrafficking.ohio.gov. You can find points of contact for your community's Human Trafficking Coalition, protocols for helping minor and adult victims, and information on Ohio anti-trafficking laws.